You are listening to the AOTA podcast. Here is your host, Matt Brandenburg.
Our presenting sponsor for the AOTA podcast is New York University Steinhardt's Department of Occupational Therapy. Today we are joined by Christine Urish. Thank you so much for sharing your time and being on the show with us, Christine.
Thanks for having me. I appreciate the opportunity to share my information.
Yeah, I'm excited for this interview. I've been looking forward to it. And I know you are a professor at Drake University and also a senior occupational therapist at University of Iowa Hospitals. Your qualifications don't stop there, Christine. You're a board-certified OT in mental health, two-time recipient of the Outstanding Occupational Therapist of the Year, granted by the Iowa Occupational Therapy Association. And maybe this is the one that I thought might be most important. You're known for always having emergency chocolate in your office.
Chocolate, I think, is really helpful in a variety of different situations. And yeah, I've been an occupational therapist since 1989, and I've been an occupational therapist since 1994. And I really love the profession of occupational therapy because it's diverse and every day is different as an OT or as an OT educator.
I love that. And you have a breadth of experience. Today, we're going to be discussing your work in mental health first aid. Can you kind of introduce us to what your role in mental health first aid is?
Sure. Well, just like CPR, and many healthcare practitioners have to take CPR as a requirement for employment. But just as CPR helps you assist an individual who's having a heart attack, mental health first aid teaches you how to assist and support others who may be experiencing a mental health or a substance use challenge.
I love that. So we're working with people who are having a mental health or substance use challenge. How would you kind of describe what mental health first aid is?
Well, so mental health first aid is a course. It can be taken online or it can be taken in a face-to-face format, and it offers individuals a structure for how to support an individual with a mental health or a substance use challenge. It's a course that I feel really passionate about as a facilitator, but I feel like a lot of times individuals are like, I don't know what to do, right? And having a structure, just like CPR is like airway, breathing, circulation, right? Mental health first aid offers the ALGE action plan, which gives people a structure of how to support individuals. And so this could be an individual that you're working with clinically, but this might also be a friend or a family member or somebody that is at your church or within your community.
I love that. It's such an important service and such an important course. Like you mentioned, all OT practitioners are very familiar with basic life services and support services, and CPR, and we're trained in that. And we know the steps. And call 911, find a pulse, identify if the airway is blocked or not. We know these steps, but really, practitioners are just as likely to be working with someone who may be experiencing a mental health crisis or a substance use crisis. And that knowledge really isn't there, or that structure that you're mentioning, really, some of us might feel like we don't know what to do first. So this seems like such an important service. How did you really become first interested in mental health first aid and also in instructing and educating others on this topic?
So I became interested in mental health first aid in about 2015. I had a social worker friend of mine who had been trained to facilitate mental health first aid, and she trained the occupational therapy students that I had been teaching, and we did it on a Saturday. And after about 3 years, I thought, well, I should be trained in this myself so that I could facilitate it with my students and not have to pester her on a Saturday. That happened to coincide with me changing jobs and starting work at a new university. And they saw this as an initiative that they wanted to support. And as such, they funded my training. And since I have been at this university, I have trained 98% of all the faculty and staff within the College of Pharmacy and Health Sciences here at Drake University. I've also trained all of the residence life staff, some faculty and staff in arts and sciences, as well as the university has funded other people to become trainers. So this momentum continues, and annually I train all of my occupational therapy students The adult course is required, and then the youth course the students can choose as optional to take. But typically, about 95% of the students see the value in the adult course, so they take the youth course as well. So since about 2018, I have been a youth, adult, and higher education module mental health first aid course facilitator. And I've facilitated this course with community members, with parents and teachers at middle school and high school, with faculty, staff, and students at my university, with occupational therapy practitioners at the AOTA Inspire Conference, at the AOTA Mental Health Specialty Conference, and then most recently at the AOTA Education Summit. So I feel like there are people who are wanting this information, but I think that there's still a wide, vast amount of people who maybe want to know more about what mental health first aid is and just need to have information so that they can consider if this would be a course that would be beneficial for them.
I love that. And Christine, you're such a shining example of identifying, kind of a need or an area that you personally want to learn more about, getting the training you need for that, and then growing your influence and growing your scope to, training those at your university and the students that you're a professor for, and now training and educating people across the country and within the profession. It's truly such an example for all of us. How would you really describe occupational therapy's role in mental health first aid, both in, raising awareness of what it is and providing this training?
So mental health first aid really focuses on prevention and early intervention. And so as occupational therapy practitioners, we need to do all that we can to maximize independence and function. And if we can identify and support individuals who might be at risk for a mental health or substance use challenge prior to the challenge occurring, obviously this is best. I would love to see this training included in all OT and OTA educational programs, as I feel it's very valuable. And the reason that I feel it's very valuable is 1 in 5 individuals will experience a mental health challenge each year. These are statistics that are disseminated by the National Alliance on Mental Illness. So it's important for us to know not just what to do, but how to assist those around us, not just clients, but also family members, friends, neighbors, and our community members.
That's such a great point. I think as clinicians and practitioners, we're generally pretty good at identifying and treating signs and symptoms of acute physical incidents, like a sudden change in blood pressure or consciousness. And we learn about those acute psychological incidents, but I don't know if everyone's as confident, like if they practice outside of a mental health setting, in knowing how to respond if we saw someone having a panic attack or experiencing one of those acute psychological incidents. What are some situations or examples of times when an OT practitioner may need to use mental health first aid?
Well, as I mentioned, 1 in 5 people may experience a mental health challenge at any time, annually. So it's like, it could happen anytime. Like I could walk into class and a student could be experiencing a panic attack, and I need to know how to manage this situation. Is it a panic attack, or is the student experiencing a heart attack? I mean, if it's a panic attack, I know from my mental health first aid training how to deal with that. If it's a heart attack, I get on the horn and I call 911, right? But how do people understand the process of what to do? And how do you approach the person? Because you don't want to make the situation worse. And I think sometimes if people don't have an understanding of what to do, inadvertently, they could make a situation that doesn't need to be complex more complex. And so I think that's, again, having that structure of the ALGE action plan really assists individuals in knowing what to do and how to be of help, and just giving people the tools of how to support an individual who may be experiencing a challenge.
I love that. I love that. One reason OT is so effective is because clinicians and practitioners are expert in understanding its value and understanding how to implement interventions. And that same rule would apply when using mental health first aid. What would you say are some additional considerations that practitioners should keep in mind when working with someone who is experiencing a mental health or substance use related crisis?
Right. So having insight and having a plan of how to support someone and address the mental health challenge or substance abuse challenge that the person may be experiencing is really important. This is where mental health first aid comes in. It offers structure in how do you offer assistance. And one of the most important things is safety, right? It's safety of the individual who's offering or delivering mental health first aid, but it's also safety of that individual who may be experiencing a mental health crisis, right? And sometimes we maybe get triggered or stressed out by a certain situation. And if you're not the person that could be offering support at that time, then you need to know, who do you tag in, right? Who are supportive others that can assist in that moment? And so knowing community resources and supports are really key.
I love that. Knowing community resources and supports are key. That's important foundational knowledge for practitioners across settings, I think. What are some specific risk factors or warning signs for mental health and addiction concerns?
Right. So risk factors can include like biological situations like chronic medical conditions, could include psychological concerns like abuse, history of abuse or trauma. They can include familial situations like stressful life events or a family history of substance abuse. Cultural considerations like individuals may have a mistrust of the healthcare system or historical trauma. And so the warning signs, if there is a major change in a person's thinking, feeling, or acting, and that change interferes with the person's ability to live their life, and that interference doesn't go away quickly or last longer than we would expect typical emotions or reactions to be expected to, these are some important considerations that we should be paying attention to. And so the goal of mental health first aid is to assist an individual in understanding the action plan and then teaches individuals how to safely and responsibly address a potential mental health challenge or substance use challenge. Mental health first aid really teaches about recovery and resiliency. And this really focuses on the belief that individuals experiencing these challenges can and do get better, and they use their strengths to stay well.
I love that. I love that strengths-based focus that mental health first aid has, and emphasizing recovery and resilience. That's something that I think all practitioners want to do for the people they work with. You've mentioned a couple of times this action plan, how it provides that structure, and it provides a way for practitioners to demonstrate understanding and to safely and responsibly help someone who may be in a mental illness or substance use a crisis. Can you describe for us, what is this mental health first aid action plan? Kind of what does it look like?
Right. So I can give you a brief overview, kind of like the 50,000 feet overview. We really need to attend the course to be able to enact the action plan effectively. But it's ALGE. So it's a mnemonic for the first letter of each word in the action plan. So the first one is assessing the individual for risk of suicide or harm, right? So we're approaching and we're assessing. And the thing about the ALGE action plan is this is not a linear plan. Like, I'm starting with A, but that doesn't mean that I'm going to walk up to every person and say, are you thinking of killing yourself? Like, that's not the first question that's going to come out of my mouth. But that's a question that I may need to ask, right? Depending on the situation. But so I'm assessing for risk of suicide or harm. The L is I'm listening non-judgmentally. And I think, again, as occupational therapy practitioners, we feel like we have fairly decent listening skills, but there are activities within the mental health first aid course that really show that you might not have as best listening skills as you think. And this is an area that we can always, circle back and focus on our therapeutic use of self, and how can we consider what we need to do and how we present ourselves to listen effectively. So that's the A, then the L. The G is giving reassurance and information. And so how do we offer reassurance and information that's going to be appropriate for the person, that's going to support them in moving towards a place of recovery? Then there are two E's. The first E is encouraging appropriate professional help. Now, sometimes you're going to encourage appropriate professional help and a person's going to be like, nope, I'm fine. I'm good. I don't need anything. I don't need your help. And so you never want to shut the door, right? Because you always want to be there, because at a later point in time, the person may want to reach out to you and may decide that they really want to communicate with you about the things that you've been observing. The second E is encouraging self-help and other support strategies. And so I think these are things that as occupational therapists, we really focus with our clients on. So getting enough sleep, doing our activities of daily living and engaging in leisure activities, social participation. So what are those strategies that we use on a regular basis to stay well and healthy and keep ourselves, firing on all cylinders, so to speak?
I am really impressed with this framework, and thank you for describing and introducing us to it so eloquently. I love what you mentioned about how it's not always a linear process. It's kind of a framework that has room for clinical judgment and room for application. You mentioned that there is a training process before, following a framework like this. Can you describe what kind of the training or preparation practitioners should undergo before implementing these components of the action plan?
Right. So you really need to complete the mental health first aid training to be able to implement effectively this plan. The training is, if you did it in a live format, it's 7.5 hours. It can be offered over 2 days if you did it in a face-to-face format. Or there are some individuals who do what's called a hybrid program, where you can complete a 2.5 hour online component, and then you complete 5 hours, either face-to-face or in a virtual format. And trainings are offered throughout the United States. The program actually began in Australia, and it is a program that is used by countries around the world.
I love that. It's a respected program, something that we can trust to grow the OT toolbox and ways that practitioners can help and make a positive impact in people's lives. Our presenting sponsor is New York University Steinhardt's top-ranked Department of Occupational Therapy, which now offers an entry-level OTD for aspiring occupational therapists. NYU additionally offers advanced degrees for practicing therapists that can be completed in person or online. Study and work with leading educators, researchers, and master clinicians in the vibrant setting of New York City, and have access to a diverse patient population and extensive healthcare system. Learn to deliver exceptional patient care, or deepen your knowledge and practice as you focus on applied scientific inquiry and clinical areas such as pediatrics, developmental disabilities, mental health, and assistive rehabilitation technologies. Take the next step by visiting steinhardt.nyu.edu/OT to learn more. More kind of generally speaking, what are some specific mental health first aid interventions, or what is there in addition to the action plan that comes with this course?
Well, there aren't necessarily interventions per se, but the action plan is really the focus. So the course offers information on major mental illnesses and learning about substance use challenges, and then how to implement the ALGE action plan. And the course uses a combination of case studies and videos, and it's a very interactive course. That's why I prefer to teach it, in person, face to face, because it's not just me lecturing for 7.5 hours. But there are very many different small group activities where people work individually. There's a participant processing workbook that individuals will take with them. So they have the materials and resources that they need to be able to implement the ALGE action plan.
I love that. I love that emphasis. What additional strategies or techniques could you share for how our listeners could potentially help someone who may be in a crisis or a non-crisis situation?
Right. So this is really, really important. I mean, practitioners need to know where they can get support. And so when I facilitate training, I always have practitioners take out their telephone, right? Because everybody has a cell phone. Most everybody has a cell phone. And so I encourage them to open up their contacts And I would encourage your listeners right now to open up their contacts and to add these phone numbers that I'm going to share with you. So the first number that I think many people are aware of, but do you have this in your phone? And I think, in a situation, don't want to have to be trying to think like, what's that number again? I mean, everyone knows 911, right? But everyone should also know the number 988. So 988 is the National Suicide and Crisis Lifeline. And that's a phone number that should be in your phone so that you have it no matter what, right? So 988. So that's the first number. The second number that I would like people to enter into their phone is the crisis text line. And so the crisis text line is a number that individuals can text 24/7, 365. So some people are not comfortable talking on the phone, but they would be willing to text an individual. And so that number is 741-741. So that's the crisis text line. And so a person can text anything. They can just text hello. They can text help. They can text I need support. They can text anything. And there will be somebody on the other end texting back support for that individual. So 988 is you can talk. 741-741, you can text. And then the third number that I would like your listeners to put into their phone is the Trevor Project. So the Trevor Project is a line for individuals who identify as LGBTQ. And that number is 866-488-7386. Again, I'll give that number. The Trevor Project phone number is 866-488-7386. Or if individuals want to text the Trevor Project, that number is 678-678. So texting the Trevor Project, 678-678. Many communities also have crisis intervention teams or CIT teams, or a community may have a mobile mental health crisis resource. And I would encourage occupational therapy practitioners to become familiar with what resources exist within their community.
I love that. Those are amazing resources. And that's such wonderful advice to include those numbers in your phone, add them to your contacts. I just did it as you were sharing those numbers. I had never even thought to save them as contacts in my phone, but it makes so much sense for practitioners to be prepared and enabled to share important information that could really make an impact in people that we're working with or people that we associate with outside of work also.
Definitely.
You mentioned these CIT teams and mobile crisis resources and the importance of practitioners knowing kind of what resources are available in the community. What are some tips or advice that you could tell our listeners for how to learn about those resources? Does it start with, a Google search to try and identify what's in the community, or what can they do to really educate themselves and begin to learn what resources there are?
Yeah, definitely. I mean, if you Google crisis intervention team or CIT team or mobile crisis, and then just, identify your community. I live in Des Moines, Iowa, so I could put mobile mental health crisis and then Des Moines. If you look at the community mental health center, like a CCBHC or community mental health center in your own community, they may also have some resources available. The National Alliance on Mental Illness also has a lot of resources that would be helpful that you could look at as well.
Thank you so much for sharing all these resources. I'll be sure to include them in our episode description as well, so our listeners can find the links there. Where would you recommend practitioners could turn for help if they may be feeling overwhelmed or unequipped to really properly care for someone who might be in a mental health first aid situation?
Right. So, I mean, being able to focus on the concepts of recovery and engaging clients in their own recovery. I mean, learning about the Wellness Recovery Action Plan, which is another resource that I would encourage practitioners to explore. Wellness Recovery Action Planning supports recovery. And so what we want to do is we want to help people get to a sense of what they can do to keep themselves well. And so another website or another resource that could be helpful for your listeners is Wellness Recovery actionplan.com. And so that website offers information about WRAP or Wellness Recovery Action Planning. I think, practitioners need to know that maybe they're not the right person, right? Or maybe they're not in the right mindset, but that they know resources that could assist an individual.
I love that. Sometimes just knowing where to point someone, the correct direction to kind of guide someone is the first step and the foundational step for practitioners. We've mentioned how this program and your training really emphasizes recovery as well as resilience and kind of long-term progress. How would you recommend practitioners enable those that they work with to maintain that progress in the long term?
Again, I think recovery is not like a one size fits all, right? It's not like, okay, you do this and then you're going to be in recovery, right? And recovery is very individual for the individual person. And it's like health, home, community, purpose, right? And so focusing on what is working for the individual, what is supporting them, and then what are the challenges they are experiencing, and then being able to support the individual in addressing those challenges, bit by bit. Obviously, Rome wasn't built in a day, right? We're not going to be able to fix everything all at once, but we're going to celebrate the strengths that the individual has and what they're doing to keep themselves well. But we're going to continue to offer support in the areas that in which support is needed.
I love that. And that's really the goal and the long-term focus of maintaining a positive trajectory. And it's going to be a journey. I like how you gave that metaphor of how progress isn't going to be linear and it's going to be different for every person. But with a focus and perspective like you're sharing with us today, it definitely is attainable. Could you share a case study or clinical experience of how you've seen mental health first aid help someone achieve positive health outcomes?
Sure. So years ago, I had a friend who had experienced depression off and on. I mean, it had been in treatment for her depression. Then she was diagnosed with early onset Parkinson's disease, and she phoned me one night. And it was a dear friend. She phoned me one night and asked me to come to her apartment. And she just said, hey, can you come over? Right? It wasn't like, oh my gosh, I'm like, the world is crashing around me. She's just, hey, can you come over? I just need you to come over. And I'm like, okay, sure. So when I arrived at her apartment, I assessed the situation, and she was indeed in crisis. So she was sitting at her kitchen table and all the knives in her home were on the table, and she had superficially cut her forearm. She was holding a steak knife. And when I sat down, I asked her she'd please put the knife down, that I was here to support her and I would stay as long as she needed. It was at that time I needed to start using the LG action plan. And so the first thing I did was assess her risk of suicide. She was engaging in non-suicidal self-injury, or NSSI. But I listened to her as she tearfully explained to me the recent physical challenges that she was experiencing were due to this recent Parkinson's diagnosis. I validated her feelings and emotions, and I offered hope, sharing with her that I knew that she had battled challenges in the past and that I would be there to support her through this difficult time, and that I felt that this was something that she could navigate, albeit it's not easy, but it was like she had friends and people who cared about her who were there to support her. I expressed my concern for her self-care and well-being, and I said I wasn't going to leave with those knives on the table. And we discussed options, and I asked her what she wanted to do. And the options she generated were, well, she could stay at home and I could take the knives and any horrible objects to my home and she could receive them at a later date. She could go to the emergency department and ask to speak to the crisis staff and possibly stay in the crisis stabilization unit. Or she could go to her adult son and daughter-in-law's home for the evening. So I said, okay, so we weighed all of those options. And she decided that she wanted to go to the hospital, to the crisis stabilization unit. So I could have called for medical transport, but I felt comfortable in transporting her myself. And she was comfortable with that as well. So I accompanied her to the hospital. I stayed with her until she was admitted to the CSU. And I assessed the situation throughout, right? Listening to her as my friend, offering hope, connecting her to professionals who could support her self-advocacy and self-help. And these were all instrumental in her recovery. When she was discharged from the crisis stabilization unit the next day, she called her son and she said, I want you to come to my house and I want you to take these knives because I just don't feel safe with them right at this time. And so he did. And she also connected with her providers, both her neurologist and her psychiatrist at the time, and set up ongoing support and resources for her. And she activated the system that she had previously in place to keep herself well. And she needed to get back on board with taking proactive action. Now, here's the thing. She could have just not even called me. Could this situation have turned out very differently? Yes, indeed. But I think, encouraging people to, as a society, have those difficult conversations. And when you get into a situation where a person may be in crisis, because I would consider her in crisis, right? That you're not like, oh my goodness, what am I going to do? But I think the average person walks into an apartment and there's steak knives all over or there's knives all over the table and there's a superficial wound on a person's forearm. This is going to kind of be a little unnerving. Again, another reason why mental health first aid is going to offer individuals assistance in knowing what do I do in this situation? How do I help this person? And so this is a course that anyone could take, not just occupational therapy practitioners. But again, I'd love to see this become as common as CPR.
Absolutely. Thank you so much for sharing that lived experience. It really illustrates, like you mentioned, the importance of having a structure and using an action plan like ALGE. And it's really beneficial to hear such an expert implementation of the program and how it's able to help and really provide a structure for situations like this. Christine, you've shared so much valuable information with us already, so many awesome resources that we encourage our listeners to check out. Are there additional resources or recommendations that you'd like to give our listeners who want to learn more about the topics we've discussed today?
Sure. I just have 2 resources. I know I've shared a lot, but I just have 2 more that I'd really love your listeners to go and check out. So the first one is how do you find a mental health first aid course in your own community, right? So the website is mentalhealthfirstaid.org. Or you could also just Google mental health first aid, and it's usually the first link that pops up. But mentalhealthfirstaid.org. You can go to that website and then you can click on it and find where the courses are being offered in your community. Youth courses, adult courses in specific areas like first responders. There are specific courses for first responders. There are specific courses for older adults. My colleagues who work in higher education may be wanting to have this brought to their campus community. And so there are listings of individuals who offer these courses. Certainly, if somebody wants to reach out to me, you can reach out to me as well. And I'm happy to connect you to other individuals. And there have been a growing number of occupational therapists who have become trained and facilitate this course as well. The second resource that I would love to share with your listeners is MindSpring Mental Health Alliance. So MindSpring Mental Health Alliance is an organization that's a nonprofit organization that they offer a wide range of free, and that's the best price, free webinars that focus on topics like mental health and wellness and well-being. Although it's not directly associated with mental health first aid, it's an exceptional and free resource. And so their website is MindSpring, like mindspringhealth.org. And you can go to that website and you can sign up for their newsletter, and they will email you out the webinars that they're having for a month at a time. And typically the webinars occur over the lunchtime. It's Central Standard Time typically, so 12 to 1 here in the Central Time Zone. And they're free. And I think this is a great resource for occupational therapy practitioners, but just for other community members or lay people who would like to know more about a wide range of mental health topics. And again, I can't emphasize it enough. It's free.
I love that. Those are such wonderful resources, and free truly is the best price. I would agree with you on that one. And as you're listing off these resources, I work in an outpatient pediatric setting, and I'm thinking, wow, these are such valuable resources that I can also share with families and caregivers of people I work with as well. And it's just a way to grow awareness and knowledge related to such an important topic. Christine, we've arrived at our golden nugget segment. If you could share one piece of knowledge or one recommendation to practitioners, what would you say?
As occupational therapy practitioners, we view our clients holistically. We not only care for an individual's physical well-being, but we also care for their mental well-being. They are inextricably tied together. And I know some practitioners have expressed concern in knowing how to effectively address mental health concerns that have been shared by their clients. I would encourage each OT, OTA, or OT or OTA student to seek out mental health first aid training in their community.
You've shared so many nuggets today, and that's a wonderful one to end on, Christine. Thank you again so much for sharing your knowledge and your expertise with us today. It's been really wonderful.
It's been my pleasure. Thank you so much for inviting me.
Thank you, listener, for tuning in, and thank you to NYU Steinhardt Program in Occupational Therapy for sponsoring this episode.
Thanks for listening to the AOTA podcast. Tune in again next time.